So what Nodify brings to my practice is, I think, knowing what the best next step is for intermediate risk nodules. And so on one end, obviously we cut down the number of procedures that we would have not done. We do procedures earlier than perhaps we would have done, or maybe we go to a PET scan sooner than we would have just done a surveillance. My joke with my colleagues is that my diagnostic yields are so high, but not because my skill level is astronomically higher, but because my patient selection is astronomically higher. And so Nodify has been the key to that high diagnostic yield, is making sure we're appropriately taking people for either navigational bronchoscopy, biopsy staging, or surgical resection, whatever it may be. But we're choosing correctly that patient population that may be best fitted for that. And on the flip end, we're not taking people to the OR or under anesthesia for these procedures that aren't going to truly benefit when their risks are so low or can be lowered. And so surveillance is their best option. So it really does what it says it does. That's what I would say about it.
I've had cases where I really was a little more concerned, and I got a result that was likely benign. And, it was in a patient who I was really worried about biopsying. A patient with very bad lung disease. The nodule was in a really difficult position. I really wasn't sure how we were going to get at it. I was really worried about them tolerating anesthesia and the procedure. And when I got that result and I went over it with the patient, I said, I think we can feel a little bit more comfortable just watching this. That's one of the things where I think it's really helpful, because the patient was worried, I was worried, and we got this result and we felt comfortable watching, and it hasn't changed over the last 2 years. So I think that made a big difference, because I really do think we would have ended up biopsying this. I'm not sure how well it would have gone.